Hello students, we shall start this class with a case scenario. A 3-year-old boy was brought to the hospital with complaints of failure to thrive, jaundice and vomiting. On examination, he had cataract in both eyes and hepatomegaly. Plasma glucose was 45 mg per deciliter and mucic acid test was positive. What is your probable diagnosis? Which metabolic pathway is affected in this case? We shall find answer for these questions in today's lecture. The topic for today's lecture is galactose metabolism. Before starting the metabolism of galactose, we shall see what is galactose. Galactose is a carbohydrate that is an aldohexose and it is an epimer of glucose at carbon 4. We can see D-glucose and D-galactose are epimers at carbon 4. What are the sources of galactose? The major source of galactose is lactose, and lactose is obtained from milk and milk products. Gala is a Greek word that means milk. Galactose is thus principally dietary origin. But it doesn't mean it is always necessary to supply galactose through diet. Galactose is not essential. It can be obtained from glucose inside our body. UDP glucose can get converted to UDP galactose in our body. What are the functions of galactose? Galactose is a component of glycolipids like cerebrosides, gangliosides. Galactose is also a component of glycoprotein and glycosaminoglycans. So we have seen the major source of galactose is lactose, a milk sugar. Lactose in the presence of lactase gets hydrolyzed to glucose and galactose. The other name of lactase enzyme is beta galactosidase. Among monosaccharides, galactose is most efficiently absorbed. There is insulin independent entry of galactose into the cells. Site of galactose metabolism is exclusively by the liver. Thus, galactose tolerance test is used to assess the functional capacity of liver. So, galactose tolerance test is a part of LFT, that is liver function test. Now, we shall discuss about pathways of galactose metabolism. Galactose can get metabolized through many pathways. First pathway, Laloir pathway, is the classical pathway of galactose metabolism. And there are few accessory pathways like pyrophosphorylase pathway, reduction of galactose to galactitol, and oxidation of galactose to galactonate. Now we shall see about the steps of Laloir pathway. There are three enzymes involved in this pathway. First enzyme is galactokinase, abbreviated as GALC. Second enzyme is galactose 1-phosphate uridyl transferase, abbreviated as GALT. And third enzyme is UDP galactose 4 epimerase, abbreviated as GALE. First, beta-D-galactose in the presence of galactose mutase gets converted to alpha-D-galactose. Then alpha-D-galactose is phosphorylated in the presence of galactokinase at first position to produce galactose 1-phosphate. This step requires ATP. Then galactose 1-phosphate combines with UDP glucose in the presence of galactose 1-phosphate uridyl transferase to produce UDP galactose and glucose 1-phosphate. This glucose 1-phosphate can be converted to glucose 6-phosphate, and this glucose 6-phosphate can enter glycolysis or pentose phosphate pathway. This UDP galactose can be epimerized to UDP glucose in the presence of enzyme galactose epimerase. This UDP glucose can help in glycosylation also, and UDP glucose can contribute to glycogen production also. Now we shall discuss about alternate pathways of galactose metabolism. First, we shall see about pyrophosphorylase pathway. Galactose can be metabolized by pyrophosphorylase pathway only after 4 to 5 years of age, because this pathway becomes active only after 4 to 5 years of age. First step, galactose in the presence of galactokinase gets phosphorylated to galactose 1-phosphate. Then galactose 1-phosphate combines with UTP in the presence of pyrophosphorylase to produce UDP galactose. UDP galactose in the presence of epimerase gets converted to UDP glucose. This UDP glucose in the presence of pyrophosphorylase can get converted to glucose 1-phosphate, and this reaction will release UTP. This glucose 1-phosphate can now be converted to glucose 6-phosphate, and glucose 6-phosphate can enter glycolysis or pentose phosphate pathway. Next, alternate pathway of metabolism of glucose. Galactose can get reduced to galactitol, and galactose can get oxidized to galactonic acid. Galactose in the presence of aldose reductase gets reduced to form galactitol or dulcitol, whereas galactose gets oxidized in the presence of galactose dehydrogenase to produce galactonic acid. Now we shall discuss about inborn error associated with galactose metabolism, that is galactosemia. Any defect in metabolism of galactose can lead to accumulation of galactose. There are different types of galactosemia. First type, that is classic or type 1 galactosemia, is most common and most severe type. It is due to defect in enzyme galactose 1-phosphate uridyl transferase. The second type is benign galactosemia, which includes type 2 galactosemia and type 3 galactosemia. Type 2 galactosemia is due to defect in enzyme galactokinase, and type 3 galactosemia is due to defect in enzyme galactose epimerase. So type 1 due to GALT defect, and type 2 due to Galk defect, and type 3 due to Gale defect. What are the clinical features of galactosemia? This is a classical picture of an infant presenting with galactosemia. This picture is given in many books and many other resources also. The child can present with brain damage, cataract, jaundice, enlarged liver and kidney damage. If a galactosemic infant is given milk, unmetabolized milk sugars build up and damage liver causing jaundice and enlarged liver, damage eyes causing cataract, damage brain and damage kidney. Now we shall discuss the biochemical basis of clinical manifestations of galactosemia. First, hepatomegaly. Hepatomegaly is due to accumulation of galactose 1 phosphate in liver. And next, hypoglycemia. Accumulation of galactose 1 phosphate in liver inhibits glycogen phosphorylase. Glycogen phosphorylase is an enzyme for glycogenolysis. Thus, it inhibits glycogenolysis. If glycogenolysis is inhibited, the stored glycogen cannot break down to form glucose. Thus, there is reduced blood glucose leading to hypoglycemia. What is the reason for jaundice in galactosemia? Due to hypoglycemia, there is reduced blood glucose. So, glucose is not available to undergo uronic acid pathway to produce glucuronic acid. So, there is reduced glucuronic acid. We need glucuronic acid for conjugation of bilirubin so that bilirubin gets excreted in urine. Since glucuronic acid is reduced, there is reduced conjugation of bilirubin leading to increase in unconjugated bilirubin. There is generalized amino aciduria or albuminuria in galactosemia. That means excretion of amino acids and albumin in urine. It is due to renal damage. Why there is renal damage in galactosemia? Because of deposition of galactose 1 phosphate in renal tubules. The next clinical manifestation is mental retardation. It is due to brain damage. Why there is brain damage? It is because of accumulation of galactose 1 phosphate in nerve cells. Next clinical manifestation is cataract. The characteristic cataract in galactosemia is called oil drop cataract. Like in diabetes, we have studied the characteristic cataract as snowflakes cataract. Like in Wilson's disease, there is sunflower cataract. Why there is cataract in galactosemia? Because in galactosemia there is excess accumulation of galactose. So galactose will be channeled to polyol pathway leading to accumulation of galactitol or dulcitol. This galactitol or dulcitol is an osmotically active substance that can cause osmotic damage to lens leading to loss of transparency of lens leading to cataract. What are the investigations done to diagnose galactosemia? So, galactosemia is a condition in which galactose gets accumulated. Thus, there is increased level of galactose in blood and urine. Urine Benedict's test is positive because galactose is a reducing sugar. But glucose oxidase test is negative because glucose oxidase test is positive only for glucose. Mucic acid test, which is specific for urine galactose, is positive. Positive mucic acid test gives broken glass appearance. We can see broken glass appearance in test tube. If we take out, keep it in a slide and see under microscope, we can see broken glass appearance. Paper chromatography is a technique used for separation of carbohydrates. Thus, it can be used to separate galactose and hence to diagnose galactosemia. This is dried blood spot. We cannot take huge amount of blood from a newborn. We can prick newborn's heel and we can take the blood drops and blot it in this paper and let the blood dry. This dried blood spot can be used for further analysis. This dried blood spot is usually used for newborn screening, that is enzyme assays. Prenatal diagnosis, that means we can diagnose galactosemia before delivery itself, but it is not done for everyone. It is done only for people with positive family history. Prenatal diagnosis includes amniocentesis, that is the test done in amniotic fluid, and chorionic villi biopsy, that is done with biopsy of placental tissue. What is the treatment for galactosemia? In galactosemia, already galactose gets accumulated. So, lactose and galactose free diet should be administered till 4 to 5 years of life. Breast milk is avoided. Special lactose free formula like soy protein isolate can be used. Calcium and vitamin D supplements should be given. Frequent monitoring should be done. We should watch for symptoms. If there is positive family history, galactose free diet is suggested during pregnancy or gestation itself to the mother. Thank you.